Thank you so much. David Reed, here locally at Moffitt and Johns Hopkins All Children's. First off, thanks to the Pediatric Cancer Foundation. Thank you to all the speakers and the tremendous reminder of why we're here, what we're doing. It gives me great pleasure every single year and I'm honored to present the Heart of Gold Award. There's so much medical and clinical trial talent and research talent in this room. There's so many people I look up to. Such a strong bullpen here. So many good people that are part of this project. So it's always so hard to choose from amongst them. This year I'm honored to present the Heart of Gold Award to my colleague, my friend, and one of the people I look up to in this room. One of the most hardworking and passionate people that I know, Mike Isikoff. He's a pediatric hematologist oncologist from Hartford, Connecticut. He has no idea, actually. He's not from He's pretty good off the cuff. He's affiliated with multiple hospitals in the area, including Connecticut Children's and Hartford Hospital. He received his medical degree from NYU. He graduated from Michigan, but I don't hold it against him. School of Medicine. He has been in practice for over 15 years and is the chair of the Sunshine Project's protocol committee. He does heroic work organizing all the ideas and getting us to the very best protocols. His work and support are very greatly appreciated, and he has helped grow this to where we are now, and I thank you very much.
I'm Kathy Ireland.
Where's all the 45-year-old guys in here? Come on. Wow. I'm a bit shocked and almost speechless. Almost, because as David knows, I've probably talked to him a few times, but I can think of a few things to say. I am incredibly humbled to receive this award and truly am shocked by it. I think about why I went into this field, and there are a lot of reasons that one might become a pediatric oncologist. And there are so many reasons that affected my life early on that drove me into this field. One of them was when I was a medical student and met an 18-year-old young woman who was walking across the street and fractured her leg and had an osteosarcoma. And I knew when I met her that that's who I wanted to take care of. And that affected me, and I always think of that. And through the years, I've been inspired, humbled by the patients and families that I've met. God, my heart's racing. I'm not sure if that was from meeting Kathy.
He's so glad to see Palmer's not our corner.
So I've been inspired by so many patients and families, and really have created a drive in me for us to do better. As has been said, I mean, 1986 is when we made our last improvement in osteosarcoma. That's pretty frustrating. It's equally frustrating having run a national clinical trial to try and identify a new drug for that disease and have that not do anything. We need to do better. I also am thinking of a story I was just telling a few of my colleagues out there, kind of about this jacket that Damon just was making fun of me for wearing it, because I often don't wear a sport coat, and this happens to be my only one. And because of that, I often think about and inspired by a small story that I'll tell you about this jacket. Most of us in the room, all the men are wearing sport coats. And if you reach into your pocket, I would imagine, well, except Dr. Loeb. When you reach into your pocket, some of you might pull out cards and wedding announcements, bar mitzvah announcements, and all sorts of things. And I actually did this earlier. When I was telling the story earlier, I wasn't wearing my jacket and I wasn't sure what was in there. And I had no idea that Damon will attest that I did not know that I was getting this. But I did reach in my jacket earlier and I pulled out what I often have, which are funeral notices, obituaries of my patients. And that, I keep close to my heart when I'm wearing this coat, and it drives me to do better. And I think that my colleagues in the room share that. We all want to do better. We want to make a difference, and I am truly grateful for the opportunities that the National Pediatric Cancer Foundation has provided to us to be able to bring colleagues from around the country so that we can have the opportunities to do better and make a difference. So thank you very much. I truly am humbled and appreciate this honor.